Lower back pain is one of the most common reasons that people go to the doctor. And even then, it's very difficult to get rid of. I'm going to review 3 stretches that I give to all my patients, but each one is unique. The first stretch is for the individual that complains of pain below the belt, in the backside, or even into the hip and lateral thigh region. We're going to be stretching the gluteal muscles and the iliotibial band, to a lesser degree the hamstrings. Each of these exercises should be done for about 30 to 45 seconds. The stretch I recommend is called the pigeon. The knee is bent at 90 degrees and we're just trying to sit on the floor. This can be modified by being done on a couch or the bed. Try to keep that upper body up and the backside as close to the floor as possible. You're going to feel this in the backside and the lateral thigh. Again, hold for about 30 seconds. The next patient will have pain that's above the belt line and may even radiate all the way up into the rib cage area. We're going to be stretching the lumbar paraspinals, the thoracic paraspinal, the quadratus lumborum, and to a lesser extent the latissimus dorsi. That's the muscle that goes all the way up into the shoulder. Again, the stretch should be done for about 30 seconds and should never be more than just slightly uncomfortable. We're going to do what's called the child's pose. Hands and knees on the ground. You're going to pitch the hips back while keeping the spine straight and then reach forward. Remember to breathe. If you want to get a little bit more to one side than the other, keep the knees in the same spot, but pitch the body 45 degrees and then reach. The last stretch is a little bit different in that these individuals have difficulty standing erect, or if they get up from a seated position, they have to almost use their hands to climb up. We're going to affect the stretch on what's called the hip flexors, which is a group of muscles that actually flex the hip, but they have attachments into the lower spine. And if they're really tight, they won't allow you to stand in a nice straight posture. We're going to do what's called the Samson stretch. The leg that's kneeling is where we're going to stretch. You're going to lean forward but still keep the upper body erect. You should feel this in the front of the hip and the upper portion of the thigh muscle. Sometimes I will exaggerate the upper body in order to get even more stretch. You can do this also by putting your hands above your head and leaning to the opposite side. Again, hold for 30 seconds.